Halo semua, perkenalkan nama saya Aye Aung dengan NIM di 00255183. So, let's begin with the musculofacial or the facial muscles. Before that, we're gonna discuss about the Situs Facialis. So, this video will be about the musculi and the neurovascularization that are present at the Situs Facialis. So the first one we are going to discuss is musculi faciale. So these musculi faciales are unique because they insert directly into the skin, allowing us to express emotion like joy, anger, or surprise. Functionally, they are grouped into four categories: orbitalis, nasalis, oralis, and a miscellaneous group. So, the orbital group surrounds the eye. The most prominent muscle here is the orbicularis oculi, which enables blinking and squinting. It is essential not just for expression, but also for protecting the eye from debris and bright light. Next, the nasally group. These muscles control movement of the nose, like flaring the nostril, Although they are subtle, they contribute to expressions of disgust or intense breathing during exertion. And the oralis group. The oralis group is the most complex. It includes muscles like orbicularis oris, which encircles the mouth and allows us to speak, eat, or kiss. Each other muscles have here help elevate or depress the lip, shaping expression like smiling or frowning. And then the miscellaneous group. So this group includes muscle like occipitofrontalis, which raises the eyebrows and wrinkles the forehead. This muscle often spans larger areas and contribute to broader facial movements. Next, after we have learned about the musculi faciale, we will continue to learn about musculi mastigatores. So these musculi mastigatores include the maseta here, include the masada, and the large muscle here is called muscle temporalis, and also musculus petricoidus lateralis and musculus petricoidus medialis are also a part of musculi mastigatores. They are responsible for chewing and are innervated by the mandibular branch of the trigeminal nerve, but not the facial nerve. The facial nerve control the facial expression, but for the chewing, these are innervated. For the chewing, they are controlled by the trigeminal nerve. Okay, so let's take a look at these different facial expression. So facial expression are mainly like I said before, the facial expression are caused by the facial nerve. So when the facial muscles contract, the skin move and create expression. So the most facial muscles receive motor innervation from the facial nerve. That is cranial nerve 7, and damage to this nerve can cause facial paralysis as seen in Bell's palsy. So yeah, for example, if you are smiling, it is because of the muscle risorius. So if you're frowning, it's because of the muscle corrugator supercilii. Okay? And if you're pouting your lips like that, it is because of the orbicularis oris. Okay, so we move on to neurovascularization. So the first one is vascularization artery. So facial arteries mainly branch from the external carotid artery with minor contribution from the internal carotid via the ophthalmic artery. These branches, like the facial maxillary and the superficial temporal arteries, ensure a rich blood supply for facial tissues. The next one is vascularisasi vena. Venous drainage occurs primarily through the internal jugular vein. This system is clinically important because infection from the face can spread to deeper structures via venous connections, especially the danger triangle around the nose. Finally, sensory innervation of the face comes from the trigeminal nerve, which is the cranial nerve 5. In Latin, it is called nervus trigeminus. Okay? So while motor innervation is from the facial nerve, which is cranial nerve 7, the sensory innervation of the face comes from the trigeminal nerve, which is cranial nerve 5. So understanding this dual innervation is crucial for diagnosing facial nerve disorder and planning surgery. So this is all from now. Thank you for watching this video.